So the first thing we're going to look at, what we have here is a bovine. We're looking at the right side of the thorax. So we're going to try to identify some of the features within this area. The first thing we can see is our right subclavian artery, which is this whole chunk of artery right here. Off of our subclavian, since we're looking at the bovine, we have this large branch here, and that's just going to be the costocervical trunk. The costocervical trunk has a few branches off of it as well. We have this branch right here that's running up along the inside of the dorsal aspect of the ribs. That's going to be your supreme intercostal artery. You have this artery that's actually been cut right here and missing a little bit of this middle section. That's going to be the dorsal scapular artery. It's coming out here to some of the muscles on the medial aspect of the scapula. We then have this continuation of this little branch right here that you would still be able to call the costocervical trunk, which then gives off this large artery going more cranially towards the head. That's going to be the vertebral artery. And right next to it, going more dorsally rather than cranially, this is your deep cervical artery. So those are going to be the four branches that you're going to get off of the costocervical trunk in the bovine. Now this branching pattern is the same on both the right and left hand sides. Some of the other branches you'll see of the right and or left subclavian is going to be this branch right here, which would have been coming right up to here, and that's going to be your superficial cervical artery, and it would have that prescapular branch coming up here to the prescapular lymph node. We have this large branch that's cut. That's just going to be the axillary artery. And finally, we have this branch, this large artery that's going on the inside of the thorax and running down along the sternum. That's going to be your internal thoracic artery. Now, all of these arteries are going to have veins traveling right next to them. So this would be our costocervical vein. And then all of these would have so we'd have a vertebral artery, which you can see right here, right next to the vertebral vein, right next to the vertebral artery. You would also have a deep cervical vein right next to your deep cervical artery. We see that that costocervical trunk is draining into the cranial vena cava, along with your external jugular vein, your superficial cervical vein, and your cephalic vein. Finally, right here, we also see our right azygous vein, which is what's draining these dorsal intercostal veins. All of these, again, are draining into our cranial vena cava. And finally, here we can see our caudal vena cava has been cut because the diaphragm has been removed. In this region, we can also see our vagosympathetic trunk coming caudally down along the neck. At this area, at the right subclavian, we see a branch coming off of that, at this point, vagus nerve. This branch that goes around the right subclavian and travels back cranially up the neck is going to be the right recurrent laryngeal nerve. The vagus then continues caudally through the thorax, and around the area of the bronchus or trachea here, once we get closer to the primary bronchi, is where it's going to split into our dorsal and ventral vagal branches. Here we can see a dorsal vagal branch. I do not see the ventral vagal branch in this cadaver, but our dorsal vagal branch would travel up here and along the dorsal aspect of the esophagus. The dorsal vagal branch from the other side would then come together. So both dorsal vagal branches come together to form the dorsal vagal trunk, and the same thing with the ventral vagal branches forming the ventral vagal trunk. Here we can also see a very nice representation of the bronchoesophageal artery. The bronchoesophageal artery comes either directly off the ventral aspect of the aorta or sometimes off the medial aspect of the aorta. We see that large artery coming right down here to supply the esophagus, as well as coming over here towards the bronchi. So again, that's the bronchoesophageal artery. One other thing to point out up here would be the presence of the right common carotid. If we look up in there, we can find the right common carotid that was coming down the neck. If we follow that caudally, we see at this point a very large artery. Here is, right here in my finger, I have the right common carotid. In the forceps, I have the left common carotid. And as they continue caudally and join, this very large artery right here would be your bicarotid trunk. Okay, so right here we're looking in the same area, but just on the left side of the thorax. Here we're going to look at some other nerve structures. And the first one we're going to look at is this large chunk of nervous tissue right here. That's going to be the cervicothoracic ganglion. The cervicothoracic ganglion has a little connector, this little guy right here, that's going to be connecting the cervicothoracic ganglion right down here to the area of the middle cervical ganglion. A lot of times that's kind of tough to identify because it's usually right around or right on the medial side of your left subclavian artery. But if you follow this ansa subclavia around, it'll lead you right under here to where your middle cervical ganglion is located. Again, the middle cervical ganglion is where the sympathetic portion, so the sympathetic trunk, joins with the vagus nerve. So anything caudal to the middle cervical ganglion coming back along through here is going to be the vagus nerve itself. As it continues back caudally, you'll have a branch of the vagus come off and usually travel right around this area here. This structure you see right here, this fibrous cord that's in between the pulmonary trunk, it's not very well dissected, but I can see it right here. This little fibrous connection between the pulmonary trunk and the aorta is the ligamentum arteriosum. And it's in this area that we'll usually have the left recurrent laryngeal nerve traveling around and coming out somewhere on the medial aspect to come back up the neck. The other nerve that we would be looking for would be a nerve coming cranially off of this cervicothoracic ganglion and going up towards the vertebral artery, and that's going to be the vertebral nerve. In this area, since we're looking at a bovine, we can also see the presence of the left azygous vein. And now we can start to see some of these dorsal intercostal arteries coming off the dorsal aspect of the aorta.